Hello, happy National Puppy Day. I'm Dr. Travis Arndt with the Animal Medical Center of Mid-America. I'm here today to talk to you about common puppy questions that every new puppy owner has. So preventative care involves vet exams, vaccinations, deworming, and fecal parasite prevention. So first, when you bring your pet in for a vet exam, we're going to do a nose to tail exam, looking at the eyes, the teeth, the nose, the ears, listen to the heart, feel all the joints, make sure everything's free of disease, looking at the skin. There's several things that show up in puppies from a young age, whether it's retained deciduous teeth, baby teeth, whether it's a heart murmur, whether it's skin conditions that are common in young dogs like demodectic mange, or whether it's just mobility issues, which can be genetic, like hip dysplasia, and several others. So it's important to have those routine screenings done. And then puppies need vaccinations. So about every 3 to 4 weeks from the time they're 8 weeks of age until at least 16 weeks of age, they should have a booster of the distemper, hepatitis, parainfluenza, and parvovirus vaccines. Additionally, if they're going to go to a groomer or get boarded, go to a dog park, they should be vaccinated against Bordetella and influenza. And then depending on other places you may elect to take your pet, like hiking, camping, if you're going out of state, you need to look into lepto and Lyme disease because those are very prevalent in pets that spend a lot of time outdoors. Lastly, we follow the Centers for Disease Control prevention tips on deworming, and so it's recommended that all puppies get dewormed at least 2 times with a broad spectrum dewormer for roundworms and hookworms. So those are parasites that can be passed directly from the mother onto the puppy, and those actually can be transmitted from your puppy to your family. And so the best way to protect everybody is to get them routinely dewormed. And then lastly, we do recommend regular fecal screening. That's going to look for not just those roundworms and hookworms, but other parasites that puppies can get, like Giardia and Coccidia, which can cause diarrhea. And we want to keep your puppy safe. So when you acquire your new puppy, it's always a good idea to start the conversation with your veterinarian and find out what age they recommend spaying and neutering. There is some growing concern that spaying and neutering large breed dogs before 2 years may not be the best thing for them as far as joint disease. However, dogs that are less than 50 pounds at maturity, there's been no benefit to delaying spaying and neutering. So it's always good to get your puppy spayed and neutered before they turn 6 months. The health benefits long-term much outweigh any of the risks. So it does reduce the risk of reproductive cancers. It also decreases the risks of aggression, roaming, and other unwanted behaviors. It's important that you limit their exposure to other pets, so we really don't want you to take them to dog parks and take them out and be around strange pets until they're at least fully vaccinated around 4 months of age. However, it is important that you expose your new puppy to new experiences, new sights, new sounds, and new animals. So what we do recommend doing is finding relatives and friends who have pets that lead a fairly sedentary lifestyle and have known risks, introducing your puppy to them, especially the ones that do well with new pets. It teaches your puppy how to properly engage with other pets. Lastly, when you acquire your new puppy, start thinking about pet insurance. The growing trend in the United States is that veterinary care is getting more expensive as more and more treatments are available that can be done to help our pets. Unfortunately, as that expense climbs, having a secondary system that helps pay for it is very, very important and helps prevent limiting what you're able to afford. AMCMA partners with Trupanion Pet Insurance, and so we will give you a certificate for a free month of pet insurance for your new puppy at the time of your puppy Head Start visit. And Trupanion's a great company to partner with for your pet to keep them healthy. It's much less expensive to get them enrolled as a puppy rather than waiting until they get older. Plus, just like with humans, if they do develop a problem, that will become a pre-existing condition and won't be covered in future policies. So get them covered early to get the best coverage. This is a lot of information, but we've got a lot of helpful tips that outline our Puppy Head Start package that we have on our website, amcma.org. and we hope you'll check that out. And there's also links for scheduling appointments. Thank you very much.